Hi friends, I am Dr. Vijay Kiran, your kidney doctor. So, as a kidney doctor, I see so many patients coming to me with kidney dysfunction. So, most of the times the cause is diabetes, hypertension, and we can identify the cause and then we give treatment. But sometimes what happens is, without an exact reason, there will be a kidney dysfunction. That is, the kidney will be failing without a very obvious cause. For that, we have to do what is called as a kidney biopsy. So, kidney biopsy is an invasive procedure, and today in this video, I am going to show you how safe the kidney biopsy is and how important the kidney biopsy is. Thank you. Hi friends, today I'll be showing a live demonstration of kidney biopsy. See, kidney biopsy is a invasive procedure, but it is very useful for a correct diagnosis. What is absolutely wrong with the kidney, what is the specific disease, what is the prognosis, what is the exact treatment which has to be given. All these things are come to know with the help of a kidney biopsy, and it is not such a very dangerous procedure as people perceive it to be. There won't be any pain if you do in the correct way. So let's start the procedure. So this is the local anesthesia which we infiltrate into the skin and the subcutaneous tissue and the muscle so that the whole area is completely numbed off. So this is what is called as a renal biopsy gun. We just need to load it, and this, with the help of this, we take a biopsy tissue. Two pieces are taken for kidney biopsy. One is for light microscope and another one is for immunofluorescence.